Welcome to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield, where we invite Wellmark experts to discuss healthcare and health insurance topics that matter most. I'm your host, Kareem Amiri. Hello and welcome back to another episode of the Health Matters podcast. Today I'm super excited to have with me Laura Jackson, Wellmark's Executive Vice President of Health Equity, Access, and Improvement. And we're here to discuss Wellmark's initiatives and partnerships and the work going on around there on how to think about health in a different way. Laura, thank you for joining me today.
Oh, thanks for having me, Kareem. It's a pleasure.
Yeah, I'm so happy you're here. And before we dive into the topic today, which is a very broad topic when you think about it, can you tell the audience a little bit about what's your position, your role at Wellmark, and especially the division, because this is a relatively new division, pretty exciting, and how it is impacting Wellmark's members and people in the state of Iowa and South Dakota.
Absolutely. Yeah, it's really a pretty exciting time to be at Wellmark because we are, first of all, an amazingly strong company as it relates to making sure that we make healthcare better through the way that we provide insurance to so many Iowans and South Dakotans, and as the Blues, so many people across the country. But as we came out of the pandemic, we really recognized that we could actually do more than pay healthcare claims. While that is incredibly important, and working on the total cost of care and improving lives, we actually created a division in the company, small but mighty, that is focused on improving the lives of all Iowans and South Dakotans because we really recognized that we were paying, we continue to pay far too much in terms of healthcare costs. And there is a resounding amount of research that shows that largely what dictates our longevity and the quality of our life actually happens outside the healthcare system, upwards of 80%. And so we created this division of about 9 people, and like I said, small but mighty, with the intent that we are going to focus on improving the lives of all Iowans and South Dakotans. So it is a pleasure to do this, and we do it in a way that's very different, I think, than maybe some people might think about it, in that we use data, and we really try to understand deeply what are some of the biggest problems that Iowa and South Dakotans face to live that quality life, if you will, that lifespan and that health span. And so it's a team that is just comes to work every day, really looking for those things where we can go upstream and outside the healthcare system to make people's lives better where they live, learn, work, and play.
Yeah, and I think that's fantastic that, when I talk to employers, especially the last couple of years, healthcare has risen at a rate of like 7%, 8%. Really focusing, we're not just, like you said, not just focusing on Wellmark's members, but citizens of Iowa, South Dakota to try and really get to the root of those problems. And I'm sure employers would love to hear that and hopefully over time see those healthcare costs come down. And I know that's the aim that we have here. And, when you talk about those problems, you can go a little bit more into like how we're actually trying to do that and solve for those big wicked problems I think I've heard you say in the past.
Yeah. We call them wicked problems, and we didn't coin that phrase. So we actually went back over many decades, and things that are really big challenges in our society have often been called wicked problems. McKinsey has a great definition. They really talk about these problems as something that is complex. It happens over time. It has a lot of different stakeholders involved, and they're really hard to solve. And what we have really done is applied a lens to really a data-driven approach to understand and kind of tease apart the things that actually create these problems so we can find opportunities in the data to really intervene and change someone's quality and length of life. And you can solve them. So I'll give you a real example of what we think of as a wicked problem. If you go back 30 years ago and we looked at smoking, knowing that it would kill, right? And smoking didn't, it's still here today, but it is dramatically different than it was 30 years ago. And it took a series of things to intervene to change people's perspectives and their behaviors so that it became less of an acceptable practice or behavior. And now it's kind of like, it's kind of the exception, if you will. And so we are looking at things that we know through the literature that if you change something in someone's environment, it actually will change the length and quality of somebody's life. So we look at things like even graduating from high school, huge predictor as to whether someone can live a long, healthy life. And most people probably don't realize that. And so when we think about all the things that kids have to go through to get through and, have good physical, social, emotional, and mental health, That's a big deal. And so whatever we can do in communities to make sure kids have every opportunity to graduate from high school, that's a milestone that we aim to improve.
You know, I've heard you talk about that before, and I know there's more to it. Like, what are some of those initiatives that, Wellmark's working on and that we've implemented to date, or
Yeah.
to try and address those challenges?
Yeah, absolutely. So when we think about what we see in our two states as an example, in Iowa and South Dakota, we know that suicide is the number 2 reason that our kids actually lose their life prematurely, right? Kids should not be dying from suicide. It is 100% preventable. And so we really stepped back and said, there are a tremendous amount of talented people focused on crisis intervention when someone has ideation around suicide. And what we said as a company is we want to show up and work with others. And that is really the essence of our entire strategy, right? It's finding others that want to work on these same problems together, because no one company is going to solve this. And so we are working in both states with what's called Jobs for America's Graduates, which really helps kind of create a curriculum and a safe place with a dedicated resource that helps kids who oftentimes are racially diverse, socioeconomically challenged, and are really having trouble staying in school for whatever reason. It happens to do with the environment that they live in, might be a single parent. And the specialist really brings them back into the school, shows them that someone cares deeply about them, and shows them the importance of school, and ultimately helps them graduate and find a job. And it has been around for 30 plus years, and we are thrilled to participate and actually collaborate with Jobs for America's Graduates in both states. And it's just one example of many things we are doing to make sure we put wraparounds for the kids so that they get through this really tough time when an adolescent is developing.
So I'm sure that's so gratifying for you to see that and have some tangible examples of that occurring.
It's amazing. And the really interesting thing, too, is that JAG can exist across the entire country. So there are other Blue plans who are doing this as well. So we all care deeply about some of the very same things. And I think an exciting thing that Blues have to offer that most other carriers don't is every month we are on a call where we are sharing best practices. So we want to accelerate those good things that actually change lives, and we don't compete with one another. So we can actually say, hey, we tried this and it worked. And then another state plan might tell us the same thing. And the unique thing about that is the way that people live, learn, work, and play is really, really specific to sometimes a community for sure, but also sometimes in a state. And so the Blue plans have that local feel, but we have that national reach. And that's what makes the work that we do so exciting, because we can say we tried this, it didn't work, or we tried this and it was amazing. And we have, 30 plus other Blue plans doing the same thing with us.
That would be great for the national accounts that I work with that have employees all throughout the country. You've talked a little bit about employers that, in the past we talked about employers that live and work in rural communities.
Yeah.
In the U.S., there's 1 in 7 people that live in a rural community, but within Iowa, there's 1 in 3.
Yeah.
Can you tell me a little bit about that and some of the initiatives we have going around the rural Iowa?
Rural is near and dear to my heart. We probably, between us, probably know a whole lot of folks who grew up in rural communities and now work in an urban setting. But so many people still live in those places. And when we looked at the data, what we found was a pretty significant difference in the rate of chronic disease and what we would call preventable deaths in rural Iowa and in rural South Dakota, for that matter. And when we started to really tease it apart, again, kind of that wicked problem, we had to really ask ourselves, why was it different in the rural places than it was in the urban settings? And it really came down to 2 things. It came down to access, and I'm gonna kind of parse that apart, right? It could be access to too much of the bad stuff and access too little to the good things like certain services or healthy foods, et cetera, and capacity. So the smaller the community, the less time people have to work on the things, but they have the passion. And so when we started thinking about—
Sounds like a small employer a little bit.
Exactly, right? So you might have multiple jobs. And so if you don't have the capacity and the wherewithal to know all the things you could do to improve your community, it can start to erode because you don't have access to the services right in front of your very eyes. And we all took that to heart and said, you know what? Rural communities are an amazing place to grow up because you do get to be out and about and engaged with so many things. But if we see the stats that we're seeing with the rate of chronic disease and preventable deaths, we said we've got to step up and do something. So that's exactly what we've done. Is we've created a coalition of the Regents universities, the governors and lieutenant governors in Power Rural Iowa. We have the Rural Development Council that is statewide in Iowa. And we literally decided that we've all been working on this challenge, but what if we actually pooled our resources and worked on it together? And so we opted to choose 2 pilot communities that look very different, that literally want to try something new and approach their planning in a way that is completely holistic, that starts with health and ultimately can create wealth in their community.
That's great. Some, like-minded organizations getting together, a lot of smart people getting together, trying to address these problems. When you look at that and look at the bright future that they're looking for, what impact do you hope that these initiatives will have on rural healthcare in Iowa specifically?
Yeah, my dream, my vision, and I would say that I share this with all my coalition members as well. We fundamentally believe that we can show communities a very different picture of who they are because we can do it through a framework called the wealth capitals. So you can see the totality of, you might invest in bringing jobs into a community, but what if it's the wrong jobs that don't actually make lives better? What if you take things away from the natural resources, and so future generations are left without those? So this creates a holistic approach with the intent that we will have outcomes and kind of proxy measures. So ultimately, when we create the plan with the community and we help them implement those changes, it will be done in a way that they've not done this before. And they will start to see that people are healthier and that they're more socially connected and that they know actually how to help themselves create that brighter future. So we're looking at metrics that we've taken kind of a snapshot today. And then as they implement that plan, we will monitor those metrics and see if what we believe to be true from the research, if those are implemented, if those actually create better outcomes for the people who live there.
Is there any pilots going on right now that we can talk about? Or
We can,
Awesome.
yeah. So the 2 pilots that we chose, and we intentionally did this to say, let's get it right before we try to scale. We chose a community called Manchester. It's a town of about 5,000 people in northeast Iowa. And then we chose Van Buren County, which is countywide, and it was their choice. And we thought, you know what, pilots are meant to be learned from, and you kind of work together, and they help us make it better. And so we chose to do 2 very different looks at this. And so we look at everything from the health outcomes to the way their economic structure is, to the types of jobs, to how many people in those communities actually are on, let's say, commercial insurance versus Medicaid versus Medicare or uninsured. And we look at the health of the school children and how well, they're making it through school and graduating. It's the entirety of those communities that we will go back and give them a picture of what it really looks like to live in Manchester or Van Buren County today. And then with those community leaders, we are putting together plans to address in priority order the things that are going to make the biggest difference in their length and quality of life. And so where we're at right now with both of those pilot programs is the experts, if you will, through the coalition, but all through many state agencies, are coming together to look at the picture of their community through the data and also the qualitative surveys that we've done. And we will go back after the first of the year and actually share those themes or opportunities and start planning with the communities. So it's pretty exciting work.
Yeah, that is. When you think about the employers that are listening to this, is there ways that they can reach out or interact or work within their community to support the efforts that we're trying to do, or the coalitions that you're working with?
I am so glad you asked that, Kareem. So when I think about what I've learned over many, many years, and I think about if I was living in a smaller community or even the community I'm in today, we know, like I said, that 80% of what creates your health outcomes is actually where you live, learn, work, and play. So when you think about as an employer what you can do, if you want your employees to volunteer, if you want to get involved in kind of the city policies, thinking about those evidence-based things you can do. So focus on the schools, focus on making sure those kids get through life in a way, because we're going to need that workforce, right? So for every 3 people that leave the workforce, we only have 1 behind them. So if those kids don't have great lives through school and they can't go on to have meaningful jobs or go on for, secondary education, that would be a place I would encourage people, because like you started out saying with the rural initiative, if I as an employer have employees who live in a community and that community doesn't create a great place to live, learn, work, and play, then I'm not attracting healthy employees. And then ultimately, I'm going to pay through my health insurance plan for those individuals. So it's not the individual's fault. It's the environment that they actually live in. So reinvesting in that environment is one of the biggest things that any employer can do, regardless of where you actually are located.
That is great. I know, like you said, this is a new, small but mighty group that you're working with and leading. And I'm sure there's going to be an evolution, and I'm excited to have you hopefully come back at a future date. 'Cause unfortunately, today our time's up. Unless there's anything else you want to talk about.
I'll make you a promise. So
Okay.
I would love to come back because we've actually hired the University of Iowa as an evaluator to actually monitor this program and evaluate it as they go along. They will actually publish a paper at the end of this to let us know what worked, what didn't, what needs to change, and how we could actually scale it. So that's going to be very exciting. So it's not Wellmark deciding if it worked. It's actually an outside evaluator looking at the entirety of the coalition to say, you need to share this good news with others, and everybody should go and do this type of work.
Yeah, and I'm sure from there we'll continue to work, create iterations.
Absolutely.
It'll be a constant cycle of
Absolutely.
improvement.
You got it. That's what life's all about, right?
Awesome. Thank you for joining me today. And, it's clear we're making significant strides, like I said, and I hope that you can come back and talk. A year from now, we can see what has evolved by that point. And for those listening, if you do have further questions, please reach out to your Wellmark representative or account manager. And thank you very much.
Thank you, Kareem.
So if you want to continue the conversation about today's topic, please reach out to your Wellmark representative. And thank you for tuning in to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield. Take care.